Health Symposium. We will get started shortly. Shortly means now. It's 10:01. So good morning, everyone. My name is Kim Ratliff, and I'm the events coordinator for North Carolina's 12th Congressional District. It is my honor to welcome you to Congresswoman Alma Adams' virtual event to observe Men's Health Month. Today's topic is the inaugural Men's Health Symposium. So we want to thank you all for joining us, and we will jump right into our introduction of Congresswoman Alma Adams. Dr. Alma S. Adams was first elected to Congress in 2014. She is co-founder of the Black Maternal Health Caucus and the founder and co-chair of the bipartisan Historically Black Colleges and Universities, or better known as the HBCU Caucus. Join me in welcoming Congresswoman Dr. Alma Adams. Over to you, Congresswoman.
Thank you very much. Good morning, everyone. Thank you so much, Kim, for that introduction. I am Alma Adams, Congresswoman for the 12th Congressional District, of which I am so proud to represent. Includes the city of Charlotte, Mecklenburg County, the towns of Davidson, Cornelius, Huntersville, Pineville, Matthews, and Mint Hill. I do want to thank each of you for taking the time to join today's discussion in recognition of Men's Health Month. Healthcare is one of my 4-H priorities in Congress, along with hunger and housing and higher education. But unfortunately, healthcare has never been equal in our country. In the 1996 convention of the Medical Committee for Human Rights, the Reverend Dr. Martin Luther King said, and I quote, "Of all of the forms of inequality, injustice in healthcare is the most shocking and most inhumane." So today, I hope you will leave here with information and resources that will allow you or a loved one to thrive. And men, when you leave here today, I want you to be focused on your health. Because information is power, and power is what makes the difference in lives and communities. Information put into practice is powerful, and this information can save or simply improve your life. Our panel of experts, good-looking gentlemen here, will affirm that men's health is not just a men's issue. Men's health impacts our spouses, parents, children, siblings, friends, and coworkers. The COVID-19 pandemic and our nearly 2 years of lockdown, stay-at-home orders, and limited capacity interactions with family and friends only made the issue worse, especially mental health issues. Additionally, many Americans who contracted COVID-19 have developed a condition commonly known as long COVID, with effects that range from invisible to debilitating. Unfortunately, far too many Americans, more often men than women, still haven't sought medical attention that could improve the quality of life. Many people, again, more often men than women, avoid talking about their physical health concerns with their families, with their friends, or their physicians. They suffer in silence or treat themselves with the over-counter medicine. And statistics show the deck is stacked against men who have a life expectancy of 76.1 years, whereas women average 81.1 years. They are 4 times more likely to die by suicide. Men less likely to visit a doctor for exams and preventative care. And they account for 92% of workplace deaths and are of greater risk of heart disease, cancer, injuries, stroke, and HIV/AIDS. In Congress, I'm continuing to work to ensure that all who need medical care have access to it. This past March, Congress passed the government funding omnibus package, and that will help our communities recover from this global pandemic. In addition to Men's Health Month, June is when we celebrate Father's Day. We want our men to remain healthy and in our lives. And we can do that by supporting them to make better choices, such as eating healthier, getting moving and exercising regularly, and making prevention a priority for themselves. The goal is to get our sons, our brothers, our husbands and fathers to change the narrative on what has been the problem for decades. Only 40% of men go to the doctor when they have a serious health scare or issue. 21% of men avoid going to the doctor because of the fear of the diagnosis. Well, that's got to change. The statistics are devastating, and there's much work to be done because none of the men in our life is a statistic. Their dads, their sons, their nephews, their uncles and granddads and grandsons and students, their mentors, leaders, and friends. And that's why today's discussion, our inaugural Men's Symposium, is so very timely and necessary. As Men's Health Month ends, let's work together to turn these trends around and create a cultural shift in which men seek out medical help whenever they need it. I'd like to thank our distinguished panel of experts, Dr. Augustus Parker, Dr. Richard Natal, Dr. Yeli Oruko, and Dr. Raynard Washington, for leading on the front lines of the health issues and for sharing their wisdom and insights specifically on men's health with us today. I look forward to hearing from each of them, and I want to thank you all for joining us today for this very important conversation. Now, let's talk about men's health. Kim, back to you.
Thank you so much, Congresswoman. I know it's a delight for everyone to have you here today. We have curated a distinguished panel of expert guests who are leading on the issues of men's health in the 12th Congressional District. Our first panelist is Dr. Augustus Parker. Dr. Parker is a board-certified physician, normally specializing in women's health care, who has devoted much of his time to the Carolinas in recent days. He is also the city coordinator for the National African American Wellness Initiative. The greatest thing, couple of good things about Dr. Parker that I'll say briefly. He recently completed his first book called Mining Diamonds. I'm not sure if that diamond is a reference to him being a Kappa, but we'll let him explain that. But Dr. Parker has 3 adult children, all of who are physicians here in Charlotte. So they helped lure Dr. Parker here to Charlotte. So now we will hear from Dr. Parker.
Thank you, Kim, and good morning to everyone. And thank you to Congresswoman Alma Adams and for allowing me to be a part of this esteemed panel. Congresswoman Adams has got me doing double duty. I am pleased to say I was the first male to be a part of the Women's Health Symposium, and now I'm on the Men's Health Symposium. So many of you, knowing that my background is in women's health care as an obstetrician gynecologist, might ask yourself, why is Dr. Parker on this panel? And let me just say that I've devoted my career to addressing health disparities, particularly for communities of color. And so that transcends sexuality in that regard. But I do have a unique perspective that I want to offer relative to women's health care and men's health care. And that is that as an obstetrician gynecologist, I know all too well that women engage the healthcare system at a very early age. Women would often come to me in their teens, 14, 15, 16, and on through 20 years of age as their first encounter with the healthcare system. And oftentimes it was, quite frankly, to receive birth control, to prevent an unintended pregnancy. And sometimes, if they were pregnant, to receive prenatal care. And that was their early introduction into the healthcare system. And because of that, they came back annually for pap smears, for mammograms, for general health care. Well, there is no parallel to that for African American or men in general. There is no parallel to that. Men do not engage the healthcare system. We jokingly say sometimes that men don't engage the health system until something's broken or fallen off. So in that regard, we've got to find a way to engage men early on. As was mentioned by Kim, I am the city coordinator for the National African American Wellness Project. And in that initiative that started in 2004 in my hometown of Columbus, Ohio, we did a study on a collective of young men aged 18 to 30 to see, to help them gain employment and training. While we had them in that collective, we were able to do health screenings on them. And these are men that are young men, age 18 to 30, and we found that 90% of them had abnormal numbers. That told me that men get sick early in their life. It doesn't start at age 50, 60, and 70 years of age, but the ravages of a lifetime of maybe bad habits, poor nutrition, subjective to systemic racism in healthcare. And we need to deliver not equality, but equity in healthcare, meeting people where they are and providing them and allocating resources and opportunities as needed so that they can have create equal and great outcomes for all. We have to address things like weathering and allostatic load, the burden of chronic stress on us as men and our responsibilities, and particularly for men of color and African-American men. So I've touched on several things, but I'm going to pause there and allow our other esteemed panelists to weigh in on this vitally important topic. Thank you.
Thank you so much, Dr. Parker. Next up is Dr. Richard Natal. Dr. Natal is a board-certified urologist who specializes in men's health and prosthetic urology, which includes the treatment and common, whoops, Sam, you knocked me out. Sorry about that.
That's okay.
The treatment of common conditions affecting men, such as low testosterone, chronic urinary problems, including stress, urinary incontinence, erectile dysfunction, and Peyronie's disease. I hope I said that correct. So
yes, ma'am.
He is also the president and chair of the board director at Carolina Urology Partners. So at this time, we will hear from Dr. Richard Natal.
Thank you, Ms. Ratliff. First and foremost, I wanted to thank the Congresswoman very deeply for this opportunity. I'm obviously very honored to be amongst the esteemed guests that are on our panel and to be considered within that group of folks. For me, men's healthcare is a passion because of the lack of advocacy that we have to date. I think there's a lot of work that needs to be done in community outreach to men in general. I do have a particular sensitivity to the community outreach that's necessary for African-American men who are at higher risk, for example, for prostate cancer, not only the development of the disease, but the development of more aggressive disease and the potential for complications that come from the more aggressive disease and the treatments that we need to engage in. So community outreach, advocacy, being a champion for men's health is important to me. A lot of my practice, when I focus on these issues that we were just mentioning, the testosterone, erectile dysfunction, all the rest, these are some of the topics that are difficult for us to actually talk about to our primary care providers, talk about with a urologist like myself, or even talk to our spouse about. So I take the time often in my office visits to explain the journeys that I've gone through in my life. There's the old joke about the hair club for men. Well, I have low testosterone, I have urinary issues, and I try to share my experiences to break down the barriers in communication that happens between a provider and the patient. Because we need to work together. We're a team. We're going to get you better. We're going to work on fixing the problems that you came in with and making you better for the next day, for you, for your family, for everybody in your community that relies on you. So again, I really appreciate the opportunity. I look forward to answering questions, and I'll turn the panel, my time over to another one of the panelists.
Thank you so much, Dr. Natal. At this time, we will hear from Dr. Raynard Washington. Dr. Washington is the Mecklenburg County Health Director. He is responsible for directing all public health and environmental health activities of Mecklenburg County's Public Health Department. Prior to his appointment to this role in December of 2020, he served as Mecklenburg County's Deputy Health Director leading many of the department's internal operations, including aspects of the COVID-19 response. At this time, we will hear from Dr. Raynard Washington.
Well, thanks, Kim, and thanks, Congresswoman Adams, for having this very important event during the month of June, which is Men's Health Month. As I think has already been clearly stated this morning, men play a very integral role in our society, both in terms of the culture of our community, our life, and growth of our community as well. And unfortunately, historically, as Congresswoman Adams has already said, as is the case in many urban areas, health outcomes for men, especially how long men are living, are poorer than that of women. And on average, that's worse, even worse, for men of color. And despite all the advancements in healthcare and society, our health as men of color continues to lag behind that of others. So these disparities are largely driven by, I think, what many of us will talk about and have mentioned this morning, but the longstanding complex social and behavioral, mental health, economic, and community circumstances that many men of color live in and that we disproportionately experience. And too often those circumstances include lack of opportunity to earn a living wage, experiencing adverse childhood experiences, other types of economic and educational disadvantage that begin very early on in life. We start to see these kinds of differences as early as birth, and they continue on through life, as well as the disproportionate exposure to community violence and trauma. And so, what's public health's role in this? I know I'm joined by a lot of clinicians today, but just to give a few points of why public health is so important in the work that must be done to address men's health in our community. First and foremost is data, and I'm an epidemiologist, so I always start with that. But what gets measured is truly what gets done, and we have to ensure that we are understanding the disparities that exist and understanding why they are and tracking progress over time so that we can ensure we're holding ourselves accountable to actually achieving the goal of closing the gap between men, particularly for men of color. We also have got to create space in healthcare for men. And where we can't create space immediately, we've got to bring healthcare to spaces that are created for men. Like houses of worship, barbershops, wherever men are, we really need to start structuring our work to bring the healthcare to those spaces. As has already been said, one of the big challenges with men is the idea of going into a doctor's office and going to a doctor to find out something wrong. So we've got to get the message out to men to know their numbers and know their status and why that's so important, and do that early on before something's falling off or before something's broken, and really disrupt this pattern of people not knowing. The last thing I'll mention is it's also important for us to really start to think about how we develop policies and programs with the health equity lens that really focus on giving every man an equal opportunity to live in an environment that makes good health attainable, which includes environments that have access to food and have access to safe places for recreation and have access to sidewalks to walk on and have access to affordable housing. And all those things influence or impact a men's ability to be healthy. And so it's important that not just we focus on the healthcare aspects, but we also got to make sure that we make living equally attainable for everybody. And so with that, I'll stop my comments and pass it on to the next person.
All right, thank you so much, Dr. Washington. Dr. Natal, I did see you had your hand up.
Click the wrong button.
Oh, okay. Just wanted to make sure before we moved on. So at this time, I will introduce Dr. Yele Aluko. He is a board certified cardiologist, which is why I wanted him here. He is the Chief Medical Officer and Managing Director for EY Americas. In this role, he is a member of the EY's Health Sector Board and advises health systems and C-suite clients on megatrends confronting the health industry, enterprise growth strategy, and business operations. At this time, let's welcome Dr. Aluko.
Thank you, Ms. Ratliff, for this invitation. And thank you, Congresswoman Adams, for your strong voice and for your advocacy on issues of health and all other important issues within your governance jurisdiction. It's a pleasure to be here with my esteemed panelists this morning. I am indeed a cardiologist. I practiced cardiovascular medicine for 25 years in Mecklenburg County. I was the medical director of the Heart and Vascular Institute in one of our health systems here in Charlotte and across its entire footprint for the last 10 years before I retired from clinical medicine and joined Ernst & Young, where I am now as the Chief Medical Officer, as well as the Director for the EY Center for Health Equity. For those of you that don't know what EY is, we are a broad multi-industry consulting firm, as well as being a tax and audit organization. I'm within the health sector, consulting business, where I am the Chief Medical Officer. Now, throughout my career, in fact, this began when I was in residency and fellowship training. I have been a student of health disparities in US medicine. And from that insight, I have become a health equity practitioner. I have been, for all my career, a vocal and visible advocate for the elimination of health disparities in US medicine. When we talk about health equity, the terminology needs to be clearly understood that health equity does not exist. Health equity is an aspirational goal. But what we need to understand, to achieve health equity, fundamentally, we have to eliminate health disparities. And to eliminate health disparities, we have to very methodically deconstruct the systemic drivers that have led to inequitable care over centuries of United States organized medicine. We are all aware that the US health system is very sophisticated, but there are large disparities within it, despite this level of sophistication. If we look at broad societal metrics of health system efficiency, and we look at infant mortality, look at life expectancy, we look at health disparities in all dimensions, and we look at pipeline of healthcare workers, Black people in general, Black men more specifically, fare very badly. Now, African-American men's health is a downstream, the adverse impacts of African-American men's health is a downstream consequence of significant upstream drivers, which have been touched upon already. If we throw a dart in any direction of the disease process, most likely you will find that African-American men fare worse than African-American women. Some of this has got to do with the fundamental mistrust that has developed for reasons that are explainable, but for reasons that we need to now begin to develop empathy and alignment about the importance of engaging the health industry. But the mistrust has been there, and it is now time for us as Black men around the adverse statistics that impact us in multiple healthcare disease entities dimensions. So the first is alignment around this is an issue. And second, it's important for us to be aware of our own personal risk profiles, not just in cardiovascular disease where I am deeply embedded, but aware of our personal risk profiles for all disease manifestations. And the third is that with that insight, first with the alignment of the problem, awareness of personal risk, the third is activation. You have to be activated to adopt personal responsibility to make sure that you manage that risk profile if it is adverse. And if your risk profile is not adverse, you continue to manage your decision-making, personal responsibility to stay in a good frame of reference for health risk. I look forward to the conversation.
Thank you so much, Dr. Aluko, and thank you to all of our panelists who have introduced themselves. Do want to have our panelists to acknowledge the Q&A at the bottom. If you get a chance, if you could answer any of those questions, either through the chat or if you could answer those live. I'll start with the first question. And since we have been home for a little over 2 years, a lot of what we do is kind of take care of ourselves. So this question says, are there any community programs or at-home tools that I can use to monitor my cholesterol or blood pressure? So since so many of us are at home, I think we just are looking for more ways to stay healthy. So I'll present that question to all of the panelists and we'll get our Q&A ready to go. So whoever wants to go first, let's go.
Well, I'm happy to go first.
All right.
We all know that cholesterol has implications with cardiovascular health, but we need to understand that cholesterol impacts cardiovascular health through different variables within the cholesterol profile. What we need to know about cholesterol is that an elevated total cholesterol could predispose a person to cardiovascular health, total cholesterol. We also need to know that there's a bad cholesterol, the LDL cholesterol, that can impact cardiovascular health, even if your total cholesterol is normal. And there's a good cholesterol. We need to know if our good cholesterol is low or high. The higher, the better, because that mitigates against risk. And then the triglycerides. And I'm saying all this to say that home kits do exist. You can get them from Amazon, you can get them from your local pharmacies, where you can do a very rapid test using a lancet for a pinprick and inserting it into the machine that comes with the test. The interpretation of cholesterol dynamics is sometimes confusing, and oftentimes you can miss important problems if you focus just on the cholesterol alone. We've seen as cardiologists several occasions when people come in with heart attacks due to blocked blood vessels, and they've had, so to speak, normal cholesterol profiles, a normal total, a normal good cholesterol, a normal bad cholesterol, and normal triglycerides. That presents a conundrum, but the reality is that the cholesterol is a superficial screen. We also do advanced cholesterol tests where we can now see that if a person has a normal total cholesterol and a controlled bad cholesterol, if you do a sub-analysis of the bad cholesterol, we find that there are excessive particles of those bad cholesterols, and sometimes the particles are too large. So what I'm saying is that it is good to get a screen, but your health should not be managed by yourself alone in isolation, especially if you don't have the medical insight to understand the complete ramifications of the results you're getting.
And Kim, if I may add to that, Dr. Aluko, one of those things that's important is family history. And I think it's very important that you have a comprehensive evaluation by a physician to bolster the results that Dr. Aluko was alluding to in the context of your exercise patterns and tolerance, your family history, which is very significant, and the stress that might play into cardiovascular disease as well. So in and of itself, I think it's great to consider things like a cholesterol test, but as Dr. Aluko alluded to, we have many other factors that impact cardiovascular health.
I'd like to follow up on what Dr. Parker just said about a family history. I want to stress the insight that a family history doesn't necessarily mean that you're going to have a problem with heart health if one of your parents or siblings did. Acquired cardiovascular disease, such as results in heart attacks, is driven by risk factors. There could be a genetic predisposition to have a high cholesterol if your father or mother had it, but it is the risk factor. So when we say you have a family history, it doesn't mean you're going to get heart disease. It means that you should be aware that you could be predisposed to have factors of diabetes, hypertension, cholesterol, or what have you. And you have to identify those risk factors, because if they are controlled, then you are not likely to get heart disease as your parents did. Or if you do get heart disease, you delay the onset and you diminish the impact. So we shouldn't focus on just the family history. The family history can predispose you to the risk factors.
Hey, Dr. Luca, I was going to make mention as a urologist, first of all, we always will be the ones that will bring some levity to the situation. And I use that as my introduction because, as embarrassing as this may sound in front of the Congresswoman and Ms. Ratliff, I tell my patients that their penis is the canary in a coal mine, if you know that analogy. I say that because I have personally taken care of a multitude of patients who came to me with a primary complaint of erectile dysfunction. And when I see that and I look at their risk profile, for example, family history, smoking history, and all the rest, I do alert them to the fact that erectile dysfunction can be one of the early signs of cardiovascular disease. Not too distant in the past, I had a patient who I'd seen first when I came into Concord about 12 years ago, 13 years ago to practice, who presented with that exact thing and came back to me 10 years later to discuss management of erectile dysfunction and had since had a cardiovascular bypass, a CABG surgery for heart disease, reflecting that data that we know that sexual dysfunction can be a predictor of cardiovascular disease.
It's a very good point. If you have risk for blockages in the coronary arteries, then you have a systemic risk for blockages in any artery. And there's very important arteries in the pelvic area that if they do get blocked, including the penile artery, but there are larger arteries that do drive blood into all of the pelvic organs. If you have obstructions there, it could manifest as erectile dysfunction way before the manifestation of actual cardiac disease.
So thank you so much for all of that insight. I've learned a lot just in that one question, but excuse me, we do have a lot of questions that we definitely want to get to today live. So one of the questions, it says, how do I find health care here in Charlotte if I'm uninsured? And we'll start with you, Dr. Washington, on that one, please.
Sure. So thanks for the question. I think one of the things, and I'll sort of add a part of my response to the prior question about being at home. I think it's important for all of us to acknowledge that healthcare is an essential service. It's just as important part of our daily routine as going to the grocery store and eating and getting your car fixed and getting your house cleaned and cutting the grass. And so especially for men, we really have got to begin to shift the narrative around the doctors is a as needed function and really is something that's routine in what we do every day. And so if we think about COVID and being at home, and folks being, separate and apart, people really should prioritize healthcare, whether it's routine screenings or dental care or even behavioral health care, because those are critical to you being able to do everything else in life. Here in Charlotte, we do have a network of low-cost primary care providers that are collectively organized under the umbrella of MedLink. And so certainly there are a number of providers who do offer primary care services to people who don't have insurance on a what you can afford basis. There are a number of those sites, including our federally qualified health centers, both C.W. Williams and Charlotte Community Health Center. There's also both of our healthcare systems have outpatient providers. The Michael Jordan Clinic, Novant has, and there are a number of locations that Atrium has in the community. And then there are also other providers that are providing primary care services. There's like Norman Community Health Center, but they're all under the umbrella or connected via MedLink. And so if you look up MedLink, and I'm happy to provide that in the chat as well, you certainly can find a list of providers there to help out with providing care. And we at the health department support many of those and have a link to how to call and see when the next appointment's available.
That would be great if you could put that information into the chat room. Does anybody want to add anything to that before I move on?
I'll just make a quick comment that, when we look at the economic impact of undiagnosed or untreated disease or late treatments, the early identification, prevention, those are so key, those things. So the time it takes to go see a primary care physician, to work on your general health, to be checked up, then has a downstream impact on the amount of essentially funds that are available in our healthcare system to deal with now people who are having the downstream effects of more complex problems. So the earlier you get it seen, the faster you can get seen, even if it's a quick visit, the better it is for all of us as a community.
Okay. All right. The next question says prostate cancer appears to be more aggressive with African American men. Do we know why? And are there any ongoing protocols improving the health outcomes for African American men dealing with prostate cancer?
So that's a complex question to answer. And I say that because the understanding of the development of prostate cancer is kind of multifaceted, right? There's not just one particular risk factor. We obviously know, as Dr. Luca was saying earlier about family history, that family history is important. Racial background is important. Dietary factors, environmental factors are all keys to the development of prostate cancer, as well as other things we've not yet identified. There's some thoughts of chronic infections maybe related, other urinary or inflammatory issues in the pelvic area could be related to it. So it's hard to pinpoint one particular thing and say this is the reason why there's a disparity in the occurrence of the disease in one racial group or the other. The one interesting study that we'll often reference to patients, though, is this concept of the prevalence of prostate cancer in people living in Asia. And then if they move to the United States and adopt a more high-fat, in particular high animal fat diet, that they have an increased risk of prostate cancer related to their relatives who remain back home. So there is a role, I think, of diet that we have to focus in on. And I think that might be part of that disparity. And of course, there's the genetic risk factors that are passed along in African-American men. The biggest thing that we're trying to do, what I try to do personally, as well as urology in general, urologists around the country, is improving awareness and access for African-American men, because they are at the highest risk. We need to address them. The idea of what we were just talking about earlier about health equality versus equity. The reality is I love this analogy that was given some time ago about a flock of sheep, and there's one sheep that needs the help, and we got to spend that time on that sheep because that sheep's part of our flock. It's the same thing here. We need to spend extra effort on African-American men, not because of any other reason, but they're the ones most at risk. So community outreach and early screening, changing some of the PSA screening parameters to account for that is super important. And that is I believe, not just my own personal passion, but something that we see throughout our urologic community.
Dr. Parker, Dr. Washington, would you like to comment?
I wanted to make just one comment, and that is that relative to the fear and mistrust, particularly for people of color, that they have in the medical profession, and Dr. Natala can help me with this, but it's my understanding that men that are diagnosed with prostate cancer, they have an overall 5-year survival rate in the 90-some percentile. But when that diagnosis is delayed because they fear going in, they fear the medical profession, with advanced disease, that drops from the 90s down into the 30th percentile for the 5-year survival rate. So it's so important that we have to address and acknowledge why there is mistrust in the community and how we overcome those barriers of mistrust. We all know the history of the Tuskegee and Henrietta Lacks and the history of eugenics, and particularly in the state of North Carolina. We need to have more providers, administrators, nurses that reflect the communities that we're trying to address and serve. So there's a lot of work to be done on that. But I just did want to emphasize the fact that mistrust leads to delayed diagnosis. but a diagnosis of prostate cancer is not a death sentence. And it is certainly, when detected early, as I said, the survival, 5-year survival rate is in the 90-some percentile. Is that correct, Dr. Natal?
Yeah, exactly right. It's interesting you bring that up because there is this kind of commentary we hear often, which is, oh, it's not a bad cancer, you die with it, not from it. And the fact of the matter is, if you look at the general numbers, about 2/3 of men, that may be true, but there's a third of them in which they will suffer the consequences of disease. And if they're not diagnosed early, that's even worse for them. Is so key. And you see that, I think, that plays a role in some of the numbers we're seeing, the disparity in African-American men versus other communities as well. So they don't have the access and or have the fear about rectal exams and blood work and all the rest that we have to do as part of the evaluation. That's where you're also seeing those differences.
I think it's safe to say, as I mentioned earlier, if we remember the 3 A's, one, we need to be aligned around the fact that this is a problem for men's health, African-American men's health. We must align around that. That's number one. Number two, we must be aware of our personal risk. And number three, we must be activated for self-responsibility and seeking out medical care to understand where you are on that spectrum of health, risk potential, or disease.
So we know about the 4 H's. Now we have been introduced to the 3 A's. So we are definitely learning a lot here. I want to remind our panelists, there is a lot of questions in the Q&A. You can just answer those, or I will pick some to answer live as well. So hopefully we can get through as many questions as possible in the next 18 minutes that we have available, or 17 minutes. So the next question says, would panel members speak to the role that chronic stress plays in all men's health, particularly African-American males, and what major factors contribute to the issue and why? Stress is big, I think, just in any community. So love to hear from the medical experts what you think about that. Waiting on you.
Yeah, if I can start this one first, because I think, again, a conversation with the urologist is always going to focus around one important thing for us, which is sex. And I think the impact of stress on our bodies can be manifested first in places like the bedroom. And, with men, all of us have the tendency to become withdrawn, to not speak, to not communicate if we're having stress. We want to dig in, we want to be focused, and we want to just fix whatever the problem is and keep moving on. And maybe we want to ignore some of the emotionality that comes with that stress. But it can manifest, for example, in that way, whether it's, erectile issues, or it's libido issues, or other things that kind of affect the bedroom interaction with their spouse. So I think it's key when, again, I joke about these things, but it is key to look at something as simple as, what does it mean for us to be, intimate, and what happens when those factors, stress impacts that. Because those things then, as we made mention earlier about the canary in the coal mine, they may be the first chip that falls in the line of many others that are there. And certainly stress, we all know, changes cortisol levels, increases, or disturbs the way we handle our blood sugars, and can, increase our blood pressure and create other scenarios which will have a downstream effect on cardiovascular health and all the rest. So I wanted to make that plug there first, because I do think it's important to, again, all joking aside, that seeing what happens in the bedroom may sometimes be a bigger reflection of the other things going on in your life.
There are several reasons why Black and brown people are exposed to stress in the United States. These reasons are obvious. It's important to understand that sometimes a human body and personality adapts to the stress in a manner that it results in internalized dysfunction. Dr. Natali spoke about disruption in hormones. And it is indeed true that you have adverse cortisol levels, And you also have increase in hormones referred to as adrenaline and epinephrine that can have direct impacts on your blood pressure as well as on your heart. And this chronic stress should be understood. This is, again, I'm talking about awareness. We have to know that the stress is here with us based on the historical context of societal constructs, as well as our workplace and our environment. Many of us have lived through the experience where we go to work, you get up in the morning, you put on your suit as a man or your work clothes, and you open your door and you go outside to the external world and you put on your game face, because you have to relate in the workplace in a manner that is professional and acceptable. And it sometimes does come with significant amounts of stress. Therefore, knowing that is not enough, what we need to do is to activate and understand how we can mitigate the stress. Mental health is an area that is an uncomfortable place for Black men to go to. And it is an important issue of awareness that our mental health can be mitigated through available resources and interventions. As simple from going from one end of the spectrum to having conversations, interacting with peer groups, to actually seeing providers and maybe therapy as well. But we should not avoid the opportunities we have to mitigate stress. We cannot control everything in our external environment that drives the stress, but we can avoid it, or we can control the adverse impacts of stress.
I just wanted to add that, I mentioned the term weathering and allostatic load, and those are the cumulative burden that stress creates relative to repeated exposure to socioeconomic adversity, as Dr. Lugo alluded to, political marginalization, racism, and perpetual discrimination, particularly for people of color. There are now a lot of studies that indicate that there's a physiologic effect at the cellular level that might affect our immune response to diseases, how we are able to fight certain types of cancers. So stress, they're beginning to look at these studies at a cellular level and how it impacts our ability to deal with disease processes or makes us more available to succumb to diseases.
Thank you all for that response. And as it relates to stress and mental health, I want to remind everyone that's joining us today that back in May, which was Mental Health Awareness Month, Congresswoman Adams did host a webinar as well about Let's Talk About Mental Health. So you can find that on the Congresswoman's Facebook page or on her YouTube page. And we did have some experts on there and plenty of resources that can help you with that. So on to the next question. We have a young man, says, I've never even had blood work done to know my blood type, nor have I had a full panel screening. I am almost 30. What can I do?
I think the easiest answer is to, oh, sorry. I was gonna say, I think the easiest answer is to schedule an appointment for a physical. And the physical will give you an opportunity to speak with a physician, as well as get some blood work done, a comprehensive panel, as well as give you a chance to connect with a healthcare professional to ask any questions you may have. We all have questions about our health that we probably wonder, and that's why it's so great to be connected with a primary care doctor, because it gives you a resource, someone that you can consistently go to that has an understanding of your health, your lifestyle, and can help guide you and help make decisions about your health as needed with you.
I think it's very important to understand that we should all have primary care physicians, even if we're healthy. And beyond that, there needs to be a relationship between you and your physician. You should feel confident enough to ask questions. You don't just go in for the examination and leave, and get a call from the doctor that says your blood tests are okay. You need to ask, what is my cholesterol? What is my blood sugar? And you need to be informed about what abnormal numbers might look like. There oftentimes, understandably, is some trepidation when people go and see a physician. There is that power gradient that is sometimes inappropriately leveraged, but your doctor has an obligation to talk to you, to be empathetic, to inform you in a very responsible manner and answer all your questions.
I can't overemphasize how important that point is to me as a physician. You know, one of the things I'll tell my patients in the room is I say, when that door shuts, you are my brother, you are my sister, my mother, my father. I will think of you in the way I would want to provide care for my family. So if I do that with you, then I know I'm unencumbered by anything else other than the best for you and how that fits into your life. And you know, sometimes we're taught in medical school to keep an arm's distance with folks and you know, be more objective in our evaluation. But I feel like that runs us into problems. I think you need to remember that the connection you have with your physician is very, very important. And if you don't have that connection, or you don't feel you can trust, or there's barriers between the two of you, then maybe time to move on to another physician and find that person that can be your partner.
Okay. So moving on, next question says, what age should I start taking colon health seriously? It was advised that men go around 40, but I've noticed younger men being diagnosed with colon cancer and other colon health issues. Dr. Parker, since you are the city coordinator, let's start with you on that one, please.
Well, thank you. I think that the general guidelines, you know, it used to be 50 and now it's back down to 45 for colonoscopy screening for colon cancer. There's also, as was stated, men are seemingly being diagnosed earlier. And if you have a family relative that has been diagnosed, then 10 years prior to their diagnosis, you should begin screening and discuss that with your primary care doctors as well as your gastroenterologists. So those are certainly things that the guidelines tend to change relative to population health statistics. And but that's my input relative to colorectal screening.
I can tell you, sorry to interrupt you, Dr. Washington. I turned 45 last year and had my screening colonoscopy. And I think the biggest concern that people have is pain or discomfort and all the rest. And for me, it was surprisingly easy. It was a great process. It is, you know, it's me taking control of my healthcare. And yeah, I had the same trepidations. Yes, I'm a physician. Yes, I know friends who are gastroenterologists. I think, you know, that inside knowledge still made me nervous to have to go do it, but it was a lot easier than what you think.
Yeah, I was just going to add, I think just want to just continue to emphasize the importance of primary care providers because they are really the gateway to all these other kinds of issues that you might need. They're the ones that can help advise you on when you specifically for your own circumstances need a colonoscopy and can get you connected to the provider. They're the one that can get you connected to a urologist if you're having ED issues. And so it really is important to have that person kind of as your quarterback for your healthcare. And so really having that relationship and starting that as early as possible before you have any health issues is so important.
Okay, next question. It says, I am 47, 230 pounds. I work out regularly, but I am trying to lose weight to get to 205. My erections can be weak without Cialis or Viagra. What can I do to have stronger erections without the need of medication additionally? I take Zoloft, I think, and Lomatron daily due to being diagnosed as bipolar years ago. I am, excuse me, I have not had an episode in over 10 years. Not sure if I pronounced that medication correctly or not, but it's Lomotrigine.
Yeah. Well, to answer the question, first of all, I think as I've said more often than not throughout this conversation, I try to relate myself and to my patients. I went through this health journey myself about 3 years ago. I was 55 pounds heavier than I am today. I was diagnosed with low testosterone and was kind of suffering the consequences of not paying attention to my own health. And believe it or not, I actually accredited the COVID pandemic to open my eyes. It opened my eyes because I saw what I knew was going to happen to us as a country, to the people that were going to get ill and suffer from this disease. And I really realized that I became the focus. I needed to take care of myself. Doctor, heal thyself. I needed to be the one that took over my healthcare and not relied on I'll be fine, everything will be okay. And I did that journey. I went through that journey. It was a systematic thing for me. It took time, exercise, focus, balanced diet, and all the rest. Maybe I use a particular platform. There's an app called Noom that I found very helpful in getting me into this better lifestyle. And I've now had a sustained response. I've lost the weight and I've kept it off. My body is in better shape now than I've ever been in my life. So those things are doable, and those will translate then into some improvements in testosterone levels if it's part of the troubles. Certainly erectile dysfunction can improve. We know with healthy diet, health, and exercise, because that also translates into some important things like reduced blood pressure, cholesterol reductions. As a matter of fact, as Dr. Luca was saying earlier, I had been for years, for many, probably 20 years, I'd had elevated LDL, and I was fortunate to have a more appropriate risk profile for that bad cholesterol, but nevertheless, it was elevated. And by losing that weight and exercising, all of my numbers are normal. My resting heart rate's in the 50s. My blood pressure is less than 120 for the top number. And all of those things improved. And it just so happened that so did those other issues that I was dealing with. So it is key to work on that, because you will see those improvements in terms of doing it naturally, so to speak, and not having to rely on medications. That last point I'll just make before I turn it over to the panelists is the last. Sometimes some of those medications like Zoloft can have impacts on our sexual function, primarily with your ability to reach a sexual climax, but it can also have an impact. The problem is that conversely, we need to balance and manage other issues while they're being prescribed. It's a discussion, and then you need to have your primary care physician of, what are the pros and cons of changing medications or coming off of them. So I wouldn't certainly stop those medications without the guidance of the prescribing physician.
If I may just add quickly, there's incomplete information in what was provided by the person who asked the question. We know your weight is, I think it was 240 or 250 pounds, or we don't know what your height is. And it's important to know what your height is so we can understand what your BMI is. That's critically important. The second issue is you work out regularly. And if you are seeking to lose weight by working out, it's important to understand the kind of working out you do, because you need to have a total body circuit when you work out. Aerobics, strength training, and so on, to optimize the ability to lose weight. We didn't talk about your diet. And most importantly, we don't know what your clinical risk profiles are. What is your cholesterol profile? You're having some symptoms of erectile dysfunction, which we said earlier, could be a manifestation of vascular disease. Saying all this to say that you need to be aware of your risk profile in general, even though your priority now is addressing the erectile dysfunction, which is very important. We need to make sure that that is not a manifestation of problems elsewhere.
All right. We want to thank all of our panelists for those comments and questions answered. Some live, and we didn't get to all of the questions. Do want to remind you that this symposium has been recorded live. It will appear on Congresswoman Alma Adams' Facebook page, also on Congresswoman Alma Adams' YouTube page. You should subscribe and follow Congresswoman Alma Adams so that you will be kept up to date, not only what's going on in the community, but what Congresswoman Adams is doing, where you can find out what upcoming events we have going on and things of that nature. So Congresswoman, before we go to our closing screen, just wanted to know if you had any closing remarks.
Thank you, Kim. Let me just thank all of the gentlemen, the doctors, for being on today and for such a vibrant discussion. I learned a lot too, listening. I see we had a number of folks on, and I do see some great questions here. And I learned a lot from the answers, things that I didn't know. So that was helpful for me as well. So thank you very much. And to our audience, please continue to follow us as we present various symposiums and issues that are of concern to our community. As I said in my opening, I do focus on the 4 H's, and health is one of them. It has nothing to do with, health is something that everybody needs. It is, as far as I'm concerned, an essential. Just like one of the gentlemen said, it's like cutting your grass and doing all the other things that you do. We need to focus on our health, regardless of our socioeconomic status, our ethnicity. We try to focus on the health of everyone. It is a big issue for our country. It's a big issue for our state. There's so many people without health insurance, so many people who have not been able to see a doctor. So we want to continue to support our community. Again, our men are not just, they're not statistics, you know, your uncles and fathers and grandfathers and brothers and husbands. It is important that your health is important for all of us in our community. So thank you, gentlemen, so much for all that you do. Thank you for your service. It is indeed the rent we pay. Thank you for keeping your rent fully paid up. And Dr. Parker and Dr. Washington, Dr. Akulo, Dr. Natal, we might call on you again. You all have been absolutely wonderful. And to the audience who have participated and tuned in with your questions and your comments, certainly we take those very seriously. We'll put this on our website, and if we have additional responses, and Kim, thank you for your leadership on this. Did a good job. Everybody have a good day and stay safe. And if you have not made your appointment to see your doctors, gentlemen, please do that. Please do that. We want you around for a very long time. Thank you so much. Everybody have a great day. God bless.
Thank you.
Thank you.
This concludes our event today. Thank you all for joining. If you need to reach our office, you can call us at 704-344-9950. Again, thank you so much for tuning in to the 2022 Inaugural Men's Health Symposium. Have a great day, everyone. Again, thank you to all of our panelists for giving your expert medical advice today.
Thank you.